Welcome to my YouTube channel. If today is your first time of watching my video, I'm Iwun Jerechi, a fertility nurse and a staff nurse midwife. And my channel focuses on women's reproductive health and fertility. And if this is the kind of content you like watching, please subscribe to my channel. Today's video will be focusing on yeast infection known as candidiasis. And this candidiasis is caused by Candida albicans. Candida is a yeast, a type of fungus that's a normal commensal on the skin, the mouth, the throat, and the vagina. And a healthy bacteria in the body called lactobacillus keep this growth in check. That means that when there is an excessive growth of this candida, it can lead to this candidiasis. But this bacteria will always regulate it in order not for it to overgrow. And we have various forms of this candidiasis. Number one, cutaneous candidiasis, the one that happens on the skin. Systemic candidiasis, when it has entered the blood stream. We have the gastrointestinal candidiasis, the one that occurs along the gastrointestinal tract. We have the oral candidiasis within the mouth and the vaginal candidiasis. And I'll be focusing on vaginal candidiasis. This vaginal candidiasis can as well be called vaginal thrush, vaginal yeast infection, vulvovaginal candidiasis, and candida vaginitis. That means it has 5 names. Number one, vaginal yeast infection, vaginal thrush, vaginal candidiasis, candida vaginitis, and vulvovaginal candidiasis, meaning 5 names to just one infection. This shows you that this infection is not really a joke, though it is not a sexually transmitted infection, but the discomfort that comes with it is not really a joke. So we need to be cautious in order not to be infected with this type of infection. And studies show that about 75% of women will have at least one infection in their lifetime. 40 to 45% of women will have 2 or more episodes. Then approximately 20% of women will have this infection yearly. So what are the signs and symptoms of this? Number one is itching, burning during urination, milky or whitish cheese-like discharge that has a foul smell, painful intercourse, soreness or redness around the vulva area, even the vagina. Now, what are the risk factors? There are certain things that can predispose someone to getting this type of infection. Number one is antibiotics. You are self-medicating. Once something happens to you, you just can prescribe antibiotics by yourself and you start taking it. These antibiotics kill the normal flora of the vagina. And once those normal flora are reduced, the candida will overgrow, thereby causing yeast infection. Pregnancy. During pregnancy, there are a lot of hormonal changes. The estrogen level will increase, thereby increasing the glycogen level. And yeast grow very well when there is glycogen, because this glycogen, they are being converted to glucose. So yeast will feed on them to multiply. Another one is uncontrolled diabetes. With uncontrolled diabetes, there is still excessive glucose, that sugar, which will help this yeast to grow very well. Then oral contraceptive pills that contains estrogen. This estrogen also increase glycogen level, which will favor the growth of this yeast. Multiple sex partners. Although it's not a sexually transmitted infection, but it can predispose you to that. When you have this candidiasis and you meet your partner, there's a possibility that your partner will be infected. So reduce the number of sex partners you have. Then immunocompromised individuals like HIV and AIDS and cancer patients. Their system can no longer fight infection. So these ones are known as opportunistic infections because the place is favorable for them to thrive very well. So all this that I mentioned can predispose someone to getting this candidiasis. Diagnostic investigation is just for you to conduct a high vaginal swab, whereby a sample will be collected from the discharge to the laboratory to go and culture it in order to pinpoint the particular organism that is responsible for that. Because a lot of infection will need this type of candidiasis. So when a high vaginal swab is being conducted, it will differentiate it from other infections. We also have the differential diagnosis, that is the infections that also need this type of candidiasis. Number one is the chlamydia, gonorrhea, and bacterial vaginosis. They also present these signs and symptoms. What are the treatment options for this infection? Since it is being caused by fungus, antifungal is the best drug. And this antifungal, you can either use the vaginal pessary cream or the tablets. Clotrimazole is an example of the vaginal pessary creams. What are the preventive measures? Number one is stop dodging. Yes, the vagina is self-cleansing already. So what are you dodging for? You are trying to reduce the normal flora of the environment, thereby giving room for yeast to grow into this. Stop self-medicating, especially antibiotics. This kill the normal flora of the vagina. Avoid wearing of tight and wet clothing. Yeast thrive well in a moist environment. So once that place is moist, it thrives very well. Try to keep it dry. Curtail the intake of sugar, because this is also use the sugar to multiply. Avoid scented feminine products, the tampons. All these things will just disrupt the normal flora around your vagina to give room for the yeast to grow. Then eat more of yogurts, especially those that contain the lactobacillus, because it will also help to make the acidic nature of the environment to continue in order not to permit any yeast to thrive. In everything, prevention is better than cure, because it is not really cost effective, it's expensive, and the discomfort that comes with it is not here. So please stay safe. Reduce the number of sex partners you have. Stop dodging. Just the precautionary measures, try to adhere to them so that you prevent this candidiasis. Thank you.